Biggest application in the clinical practice is that the combination of immunotherapy plus chemotherapy for patients who have a PD-L1 less than 50% is in fact the standard of care regardless of histology. We now have multiple phase 3 studies all looking at different platinum doublet backbones with different checkpoint inhibitors showing clinical efficacy. The majority of the studies that have been presented such that for patients with PD-L1 less than 50%, I think it's a very reasonable option to offer that patient chemotherapy plus one of the checkpoint inhibitors. For patients with PD-L1 over 50%, of course, chemo plus immunotherapy can be useful. And in fact, for patients who have significant disease burden, that probably is the treatment of choice. However, there is a possibility of using pembrolizumab alone in someone with PD-L1 over 50%. Based on the Keynote-024 study that showed clinical efficacy over and above platinum doublets alone. We don't have a head-to-head comparison in PD-L1 over 50% patient population of pembro versus chemo plus pembro, but that data might become available from other studies.